എന്നിട്ടോ ഒരു സെക്കൻഡ് വോട്ട് ചെയ്യട്ടെ. അപ്പൊ ശരിയല്ലേ?
ശരി ശരി, ഒന്ന് മ്യൂട്ട് ചെയ്തോളൂ. So, flag salutation. We, the members of Indian Medical Association, stand here to salute the national flag. Its honor and glory shall be our light and strength, and its course shall be our course. We pledge our allegiance to it, and realizing the responsibilities as the accredited members of this national organization, we swear we will dedicate everything in our power to see it fly high in the Committee of Nations. Jai Hind, Jai IMA.
Thank you, Dr. Pawan. Now, good evening to all. Today, respected Chief Guest, Dr. N Dinesh, Vice President, Midzone IMA KSP, who is also my batchmate, and today's faculty, Dr. Vinod B Nair, who is a consultant for crisis and stress management and life coach and business coach. Our own secretary, Dr. Pawan Madhusudanan, treasurer, Dr. Joseph George, other senior members and members from other branches, and my dear friends. A warm good evening to all. A warm good evening to all, and welcome to this World Health Day 2020-21. We are celebrating it every year, which has been established by the World Health Organization, the origin of the World Health Organization, the birth date. Simultaneously, we are celebrating it as World Health Day. Today, we are having a special topic from Dr. Vinod B Nair, a fairer medical profession. He is going to talk. And I invite him for the session. Before that, I invite our Secretary, Dr. Pawan, for an introduction of Dr. Vinod B Nair. Or to you, Dr. Pawan.
Yes. So let me take this opportunity to introduce our guest speaker, Dr. Vinod B Nair. Dr. Vinod B Nair is a very active medical practitioner settled in Cochin for the last 24 years. He is a human success coach and a personal facilitator. He helps people to change from what they are to what they want to be. And he also deals with the crisis and stress management and damage control exercise for corporate clients. He's a life coach and a business coach, and he has graduated the Global Honor Manager Program by the famous SP Jain Institute. He was adjudged as the outstanding performer of Nalanda in 2010, which is a prestigious training program of JCI India. And he has conducted more than 1,500 training programs in India. He is also experienced in hosting talk shows and debates in medical and current affairs in various TV channels. And now he runs his own ENT clinic and a lifestyle change center, which is attached to his own residence at Kalur. With these words, I welcome Dr. Vinod B Nair to our IMA THRISSUR meeting.
Thank you, Dr. Pawan. In between, I invite Dr. Dinesh for the inauguration of the session and his address. Sorry, Dinesh, I did forget.
Yes. Thank you, Joy Manjala, for the nice words. Actually, I was so many times I was thinking that Joy Manjala, with his active and enterprising work, is not a simple IMA president of THRISSUR. He is an institution like fellow. He deserves more than that one also. Whatever, how much the THRISSUR IMA activities have improved, we can notice for the last 2 years. Fortunately, we are having he got an excellent dynamic youngster as secretary also, Pawan. So their combination is excellent, that the IMA work of the THRISSUR district last time secured the best branch award also. I was there in the Alua when they are getting the award also. Today, as per the WHO's proclamation, the entire world is celebrating the World Health Day. This time they have selected the theme or the slogan as the building a fairer and healthier world for everyone. In India, definitely, we all know how is the health scenario goes and how is the health status of the our country also. And see, because nowadays is anyway, or Vinod is there to elaborate more on the fairer medical system. So he will tell about what is happening now and how we can make it fairer also. Actually, we are when we are the entire world is celebrating the World Health Day. We are in India. In India, we are feeling ashamed because of our system of allopathy is adulterated with this unnecessary nonsense specialties like Unani and other things. See, that is damaging. First of all, let me say, India, even though the health life expectancy 2 years was 59%, that has improved a lot. And also in epidemics and also in pandemics, we could decline the mortality of the death, and also we could improve the health status also. And also we could reduce the infant mortality and maternal mortality to a certain extent also. In all that ways, and the global coverage of the vaccine is also improved in India. We know that about the latest COVID vaccine, how India has succeeded. And we are supplying this vaccine to other countries also. So in all ways, India is planning and started working also now, but for the last 1 year only, the problem has arisen. But see, when the medical system, we think of medical system. If the system is not scientific, gone, no other country will accept it. That's the thing. In India, almost all states, or this system of modern medicine is existing in a majority way. But only some states like, Tripura, Orissa, I was astonished to see that 41% or 42% is the non-modern medicine people are there. There's Ayurvedic and the other system is going on. Because that also is because due to the fault of the government only. The government, see, India's health expenditure as a share of GDP is only 1.6% only. Like other modern countries, if this 1.6 is coming to, if India is spending to between 5 and 7%, definitely we can attain the excellent health system in India. We can improve the health facilities in India, delivering a excellent health care to the people of India. And that way we can build a fairer, healthier world for everyone. That's only possible. Now it is adulterated with another problems like this mixopathy and other things, which is not accepted anywhere in the world also. Now I don't know. No mixopathy people can save India. That is not a treatment, or that is not a thing which is not based on the science. So some science is there, then only definitely in this modern world we can survive in treatment also. Those people who are talking about the mixopathy and this nonsense, they are also coming to the allopathy people for their own survival and their own better treatment. So definitely we can see in India, in all other sources like non-communicable diseases, that state also with the change of our lifestyle and other things, we have improved a lot. But only thing the government's care allotting more funds for the health, this thing, and also improving the medical system, the medical colleges and health workers. Health workers in India is also very less. Then the state like Bihar, Orissa, and other thing, very less as compared to the people's number. So that also has to be improved by starting medical colleges and training all these things. That also needs money that the government has to spend, pump money in all states like other countries. Then only it will improve. Definitely, in this day, we can pray that definitely in the future something will happen. But only if the something will happen if our this present obstacles are removed from the scenario of health. So we can see our friend Dr. Vinod Kumar, what is going to tell about the fairer medical system. Definitely that will, I think he will give an excellent insight to the present scenario and how we can improve the medical system. Even though Vinod Kumar is a consultant, crisis and stress management expert, basically is an ENT surgeon. And also I think he's practicing ENT now. Anyway, he's also life coach and business coach. That means he can make the people as he wish. So he's an expert. I don't know whether he can change the personality of a person or not. That also he will tell. Anyway, with Vinod, with this, with these words, I request Dr. Vinod to continue with the topic, please.
Shall I?
Oh,
Yes, sir, please.
Yes.
I will share the screen. Are you seeing a blank screen?
Yes.
Black
Yes.
screen. Okay. I hope it's visible now.
Yes, visible.
My screen is visible.
Yeah.
So good evening, friends. As I understand, I hope everybody understands Malayalam also. Probably I will be mixing certain things in Malayalam sometimes. I hope everybody is aware of that.
You
Non-Malayalam.
are welcome. You are
Yeah?
welcome. You are
Yeah,
welcome.
okay, right. So today is April 7, World Health Day. Theme for the day is building a fairer, healthier world. Thank you for inviting me to the President and Secretary, THRISSUR, for this subject, which is very close to me. A fairer medical system, probably an utopian system, utopian concept, because most of us think it can't be fairer. I don't know. Anyway, we'll think about that. Basically, I'm a medical doctor. I used to practice in a hospital for 18 years, probably the known hospital called PVS Memorial Hospital, Kochi, which was shut down 1 year back. I left PVS Hospital around 7 years back to be very precise. Due to certain reasons, probably I may touch on that also, why I had to leave. So I'll go straight into the subject. As you know, everything is changing because of the COVID. But it said, all great changes are preceded by chaos. All great changes are preceded by chaos. Before I start and go into the subject, I'll take a caveat. Caveat in is actually a legal term. It's actually an exception or a forewarning that for those who don't know me, I don't mince my words. Whether people like it or not, I say what I have to say. Especially with this subject, probably you may hear certain unhappy things about our own profession, because unless you are very frank with certain things, you can't make any system fairer. Now, why this topic? Topic is because today's World Health Day, and it's time to, the WHO says it's time to build a fairer, healthier world for everyone, everywhere. That is the reason why we are thinking about this thing. Now, what is that? This is actually a very interesting video which is released by WHO on this. It's about saying, let's build how we can build a system. Gender, racial discrimination, lack of access to education, ageism, food insecurity, poverty. These are the most important things by which we can build a better, fairer world, healthier world. Interestingly, if you are a person concerning with this thing, it's your duty to remove these roadblocks. Roadblocks like gender and racial discrimination, ageism, that is the issues due to age, food insecurity, poverty, and lack of access to education. Ultimately, WHO is saying these are the most important steps for a fairer and healthier world. Now, as doctors, what is our role in this is actually limited. This is actually an administrative issue, much more than a health issue. To achieve this health, a fairer health, it's most of a mainly an administrative issue. But then we being doctors, we should know what role we have to play in this. So that is the context. Interestingly, WHO has released this picture also, says from an advanced city to an urban area, the life expectancy falls from 78 to 66. So you just being in a city, the chance that you live up to 78 is high. This is throughout the world. But if you are from an urban poor area or a local area, village area, the life expectancy is brought down to 66. This is throughout the world, not in India or something. So it is very important to build a fairer, healthier world. You have to improve the things which I said. And they say there is no one size fit for all solution to health. Building a fairer, healthier world means ensuring everyone has an access to health service, no matter how far is the distance. Just like voting, even if to a small island, you have to reach them so that they poll their vote. Similarly, wherever people are, however remote they are, we are supposed to reach out to them. And there are different factors in our lives that influence our potential to achieve good health and well-being. All of us know that. Education, income, health, housing, nutrition, technology. That's why I said it's more of an administrative issue rather than a doctor issue. Doctor issue is just part of it. Definitely, we contribute a lot to this concept, which we will come to later. And it's since there are no other speakers for today, I think it's unfair not to touch the basic concept of today's theme, right? Which is building a fairer and healthier world for everyone. COVID-19 has shown us that no one is safe until everyone is safe. That is why they thought about this concept. You remember where initially N95 masks were disclosed as the most important preventive barrier, America flexed its muscle. They asked Chinese to send in all the supplies to their country. PPE also, PPE kits. We were not making any N95 masks. We were not making any PPE kit at that time. So whoever had power and money flexed their either financial muscle or their other muscles so that they get N95 masks and PPE kits. And you know, in Delhi and Mumbai, without these things, even in UK and US, many doctors died. I think our IMA maths showed around 900 doctors have died out of in modern medicine. 900 doctors have died because of this COVID. Now we realize no one is safe until everyone is safe, and probably that is why this is concerned with not only with COVID, with other diseases also. That is why they have now come out with thinking about a fairer and healthier world. Now, COVID vaccination, Kuwait and Saudi Arabia, they have decided unless their last citizen is vaccinated, it will not be given to any other person. But it's a different issue in Dubai. They give also to the working people. And when somebody thought, Trump thought that dihydroxyquinone, that the malaria drug, which is going to be good, they actually flexed again the muscles with India so that they have to get it. So similarly, those who are powerful get everything. Even in the case of vaccination, it's like probably it is the only country, India is the only country which is supplying vaccine for 113 nations in this world. Now we know our power. Suppose we never had that system, facility in India, it would have been difficult for us. Many people would have died. So that is the relevance of having a healthier and fairer system. And we agree that health is not the right. Health is a right, not a privilege. That is another important concept. That health is a right, not a privilege. And we must end discrimination and exclusion, whether it is for COVID vaccine, PPE kit, N95 kit, or even for basic health facilities. We don't know what other pandemic is going to come to us in the future time. Nipah came, many of these things came. We are actually hearing, I heard about this PPE kit and all N95 kit. N95 kit, because of the END practice, I was advising my nasal allergy persons when they are actually having this household chores to use this to prevent the dust getting into their nose. But then PPE kit, I was not aware of that. But first time I heard about it during Nipah. And interestingly, we had a few storage for Nipah. Even Kerala government had a few supplies. I think people should mute, especially when they are entering. Anyway. So we must make COVID-19 vaccines and vaccines, tests and treatments available to all. And that is a current important thing. But that is applicable to every disease. We must get health service to all communities. That is also very important. We have rich and poor in India, so it's all the more relevant to India. So with this concept, this is basically the context of today's theme, WHO is saying. Now I will go directly into my subject, which is a fairer medical system, probably what we should think about. Now, probably why me, I don't know. They actually invited me for some other subject, but then I refused because I don't follow that system right now. I can't advise because I'm not qualified because I don't practice right now that. Now, then they said, can you speak on any other subject concerning with this thing? Then when I said about the fairer system, I thought probably I am the most qualified person to talk about that because for the last 25 years, I can proudly say I have practiced a fairer medicine even when I was practicing in a corporate hospital. I had all the right to practice what I want to practice. And when I moved out 7 years back, another 3 hospitals in Kochi itself invited me. I said, things have changed. I don't think you will be able to tolerate me. Then I have decided to continue my practice at my home because there is nobody to control me. I can have my own kind of the practice which I have thought is fair from my home. Then a friend of mine who runs an END hospital invited me. If I want to do surgery, there was a magnanimous offer from me. He offered me a choice. If you want to operate, you can come and operate in my hospital. That was Chaitanya Hospital, END surgery hospital in Kochi. I very rarely go away because I have changed my line of practice. You will not believe I have not done a tonsillectomy for the last 16 years. It's not because I don't know how to do it. I have not done a tonsillectomy in the last 16 years. I have not done an adenoidectomy in the last 14 years. I have not done a polypectomy, especially small polyps, probably for the last 10, 11 years. I was long back not doing a septoplasty because most of the things I think An important, another interesting thing, since this is IAP, a grommet. I've not done an grommet insertion for the last probably 14 years because I think there is no point in doing a grommet insertion. This is my own philosophy. I can treat it probably other ways. So, see, the thing is, this is not practical for a corporate hospital. So finally, I had to restrict my practice. Since last 7 years, I am doing less and less surgery. Probably 1 year back, I have decided an occasional surgeon should not be operating. So I even stopped doing that because I become a very, very occasional surgeon. And it is not good for the patient to do. It's not that I can't do it. It's fair or not fair on my part to do an occasional surgery, being an occasional surgeon. So I have decided not to do surgery unless it is a medical emergency when there is nobody else, or unless somebody asks for my help to go and support them. I'm 55 years. I opted out of a corporate medical practice at the age of 48, a prime time for any surgeon due to my reasons. Anyway, so probably I think I am the qualified person to talk about the fairer system of medicine. Otherwise, I would not have actually spoken about this subject. Now, what can be done? Many things can be done at different levels. At the level of government, at the level of hospitals, at the level of doctors, at the level of organizations, whether it is non-profit organization, an organization like big corporates. Society, many things can be done at society, many things can be done with the patient to achieve a fair health system. I'll go into one by one what can be done. Most important thing is government level. What can be done at government level? Before going into this, I think we should compare at least two important governments managing their health system. This is very important. Unless we know where will we stand, there is no point in saying this should be done, that should be done. We should have a comparison. Let's take the example of US, where we think that is the ultimate destination for health. Most of our doctors go, most of our ministers go there. So we think that is the ultimate place until we saw how they managed COVID. Phenomenal death rates. But then, what is the practice in US? A friend of mine yesterday I spoke to one of my friends from US who has settled in US. Is an Indian who settled in US. At the age of 63, he having diabetes, hypertension, and cholesterol. He pays a whopping sum of $1,400 per month as his medical insurance premium. Is it a fairer world? I don't know. The minimum premium, if you are above 65, if you can avail Medicare facility of the government, is $140 per month. It varies from $400 to $1,400 per month for other citizens who is not having Medicare. An average waiting time to see a specialist in US is 2 to 3 months, an average, not an emergency, a routine consultation. One of his relatives had a chest pain. He was investigated in the emergency room. An angiogram was done. The bill for 2 days was $36,000. Of course, the insurance paid. But even the best insurance, if you are having, they have a lot of different types of insurance. Not all of them pay for everything. But if you are having the best facility insurance, where you pay $1,400 per month, the maximum you get is 80%. So if you are undergoing a chest pain and an angiogram, you have to pay 20% of this $36,000 for 2 days. In that, there was a split bill. A pair of gloves was charged $54. A pair of gloves was charged $54. And probably you know how many pairs of gloves are used in a day for a patient. This is actually a charge approved by the insurance company. Everything is dictated by the insurance company. And they allow $54 US dollars for a pair of gloves. That is the state of affairs in US before we say that is a good system. They have a highly complex and expensive healthcare system in US. Multiple systems create a lot of wastage because there are a lot of, even if I am a patient attending a hospital, there are many, actually it may be spent by many insurance companies, many different systems, partly paid by them, partly paid by somebody. And the administrative cost for healthcare is a whopping 8%. 8% for administrative purpose alone, because you don't have, there is a lot of paperwork which is associated with any doctor. Drug costs are rising. The drug cost of US is 4 times of an advanced country, developed country. When they compare the drug cost, the cost of medicine with another developed country, it is at least 4 times. Doctors and nurses are paid much more. A GP is getting 2.18 lakh US dollars annum. This is an average. Whereas a specialist is getting 3.16 lakh of dollars annually. Everything has to be ultimately paid by the patient. Hospitals are considered as profit centers. For an angiogram, the minimum usual average cost is $36,000, $32,000. And for if it is a bypass surgery, it is $78,000. Of course, probably if you, this is actually a restricted amount by the insurance company. If you are not having insurance, you are finished. The charges could be 2 times, 3 times. Healthcare practices. The defensive medicine at its worst is being practiced by US doctors. Naturally, the investigation amount, the number of investigations are very high. A CT scan, the average cost is $896 US dollars, which is 67,000 rupees. An MRI is costing around 1 lakh rupee, Indian rupees, 1 lakh plus Indian rupees. Insurance, this is being paid by the insurance. And US itself, the prices vary widely. If you are going to an emergency casualty for the emergency lab test, the average cost is around $1,696. But it can range from a low of 241 to up to 4,510, depending on the market rate and the place you go. There is no restriction of any sort. There is no, very unlikely that you can go to a government setup usually. But if you are there, even then probably you will have to pay. But there is no restriction. It is all market rate. And now this we compare with the universal healthcare system of the Europe and UK. In UK, it is known as NHS, National Health Service. You know that. It is basically based on general practitioner-based system. There are 3 tiers: general practitioner-based system. Then there is emergency services. Then, of course, there is hospital service. And there is telephone advisory services. Anyone can dial 111, take an appointment. They will advise you on what to do. If you're not going to a GP, probably they will fix up an appointment if they think it is required. But to see a specialist, you have to go through the GP system itself, because everything is being paid by the government. But the most important thing is everybody has access to exactly the same healthcare. Even if you are a doctor, you will have to go through that. Even if you are a father of a doctor, you will have to go through that. Even if you are a minister, you will have to go through that. That is the system. Best practice, it is considered by in the world, I don't know, it is the best practice and cost-effective system, medical system in the world. There is a great auditing on cost control, but then that itself becomes a problem also. The NHS has a reasonable claim to be the most efficient healthcare system in the world. In 2018 OECD data, which incorporates in the health a chunk of what the UK is classified as a social care, the UK spending is £3,121 per head per citizen, whereas the France spends about £3,471, Australia £3,892, Germany around 4,000 plus, Sweden little more. So they say the UK system is cost efficient. All these places, the government, the healthcare is provided mainly by the government. That is why the comparison between the other areas. So the UK system is considered as the most cost efficient, effective system. Now, but you must have heard interesting stories from UK. Let's take the pros first. There is a very good system which improves the public health as such, because everybody has an access to that. Widespread accessibility. The system is throughout the system, throughout the UK. Probably their public health system, primary health system, GP system is very, very powerful and strong. No discrimination on the color of the passport or the race, color, nothing like that. If you are a legal citizen inside UK, you are given that system, extended that system. Illegal migrant, you will not get. If you are a legal person inside UK from outside, you will be given that system. But that is not the case in US. Any emergency system they will give you, but if it is a planned surgery like CABG or a bypass surgery, planned thing, a planned surgery, either you will have to go back to your country or you will have to pay, even in UK. That is the system. Full coverage. There is nothing the patient has to pay other than the taxes. Medication is given by the UK system, but then there is some problem with that. I'll come to that later. A very generous system. A lot of money is being given by the government to the health service. Very little paperwork when compared to the US system, because everything is streamlined, and actually promote human rights, which is not the case in US. Now let's look at the cons. Probably you would have, you are aware of a concept called it takes a lot of time. In a routine case, if it is an emergency, it is okay. Otherwise, you have to go through a GP system. Unless a GP says, which you have a choice of one or two with your local GP, you can't actually see a specialist. Because that is actually going to be a very, very tough thing. He will not refer unless he is convinced. And it is very, very difficult to convince a US GP. I'll tell you an interesting case. While I was practicing in PVS hospital, an anesthetist, an Indian a Malayali anesthetist, wanted to take out the wax of her autistic child, around 9 years old. So he will not allow, simply he will not allow. So giving a general anesthesia, even if it is an IV anesthesia, it is practically impossible. So she has to fly down to Kochi to give anesthesia to her child so that the wax can be taken out, because it is creating a lot of problem for him. So that is a problem. An average waiting list is up to 5-6 months sometimes, if it is a routine case. Lack of options. Everything has to go by the system. You don't have even treatment option is very limited. What the government says, you have to go through the system. Even the doctor doesn't have much choice. Low wages for nurses and doctors not compared with India, compared with the UK system and the US system. A very long waiting time, bureaucratic hurdles. If you want to change anything, the system has to approve. If you want to add something new, something has to be taken away because there is a fixed budget for the health. So they have to undergo through a lot of pros and cons. They have a lot of discussions. So any new thing which has to be implemented, any new treatment system which has to be implemented, there will be a great time delay, bureaucratic hurdles. So there are actually a lot of pros and cons for the universal healthcare, because when we are actually deciding on what to follow, what is an ideal system, what is a fairer system, we have to compare these two things, because these are the two gold standards in the world. So there are a lot of advantages and disadvantages for each of these. I'm not going into the details. And we must understand there is a big difference between per capita health spending between different countries, which is more than 11,000 in US. It is around 3,500 in Italy. And because this is something which is very important, we must understand something. Most of our instruments are actually brought from outside. imported from countries. So we'll have to pay the cost of the medical instruments. Probably the only thing which is available locally is the expertise. So it's very important that we have to compare the cost. Now, let's see what we can do in India, or probably most importantly in Kerala, because that is where we are practicing. I think the most ideal thing, I think personally, at least when comparing Kerala, our system is much better than either the UK system or the US system. This is personally what I believe, because we have a reasonably good public-private partnership. Most of our now government hospitals, you should come to Government General Hospital, Ernakulam. It's a fabulous place. A lot of facilities. Now they have a multi-specialty block. We have very good medical college. We take care of all the tertiary care. Then we have ultimate great private hospitals in Kerala. So probably a balance of a private and public partnership in healthcare system is the most ideal system, which will act as a check and balance system in the healthcare system. I don't want to go into that because most of us are aware of the advantage of a private. See, if it is difficult to see an ENT surgeon, you have a 3-month waiting period in UK and US. In Kerala, you can see 4 ENT surgeons in a day. That is the availability of ENT surgeons. To get an opinion, to get a second opinion, it is extremely difficult in these countries. It is much worse in other parts of the Europe. But then we have a wonderful system. If we have around 500 rupees or 200 rupees or 400 rupees, it is very much possible to have an opinion, which really matters. Okay. You don't go by the whims and fancies of a particular person or a particular doctor. You have a chance even for a second chance, a second opinion. That is the beauty of our system. I think it is the best system. But then can that be improved? Definitely. What we can do, probably let's go into that. I think the most important thing, if the government allows money, as Dr. Dinesh was saying, 1% of GDP or 1.5% of the GDP, most of the thing is actually going into corruption. You know, I don't want to explain the role of corruption, the percentage cut. They even find buying anything in the government health system, there is a corruption. Even in Kerala, there is a corruption. There is no doubt about it. So preventing corruption, I think, is the most important challenge. For that, you need a very good administrator. I think one administrator can do magic if he really wants it. Because I personally feel the corruption has come down to a great part in Central. Now, let's look at the budget of 2021, India budget. Because of the COVID, plenty of surplus funds were allotted. But then it's only from 1.2% of our GDP to 2.5 GDP, 2.5% of our GDP. That is there is a drastic step from many long years, it was around 1%. Then it came to 1.2%. And in this budget, because of the COVID, because there was people realized the importance of health in people's life, the central government allotted 2.5% of the GDP. And you see the difference. The amount was phenomenal. 95,000 crores. That is 95,000 lakh crores. That is the additional amount which was actually allotted. So that is the amount. But then, as Dr. Dinesh was saying, in an ideal setup, the government should spend around 6 to 7% of our GDP. We need to be a rich country which can afford to spend in health. That is the ultimate thing which we have to do. Okay. Now, we need to have a digital medical record system. The system has to improve. I personally feel there has to be a digital medical record system, which is partly there in UK, because they will get the basic levels. In US, because of the privacy, they will not get it. In Gulf, recently there a system has been introduced where they have all the citizens and doctors. If you go to a private hospital, you will be given a unique number. It will be generated. And that medical record, any doctor can see from any hospital or a clinic. I think that will be a wonderful system that will do away with the duplication of the investigations. That will be a very good, great medical record system. I think it is when India has gone into a digital world, I think it is very much possible to have a digital medical record system for every citizen of our country. We are actually now ready for that. But only thing is somebody has to do it. If that comes, there will not be a repetition of the unnecessary repetition of the investigations. Anybody can do that. It will contribute to a great level to a fairer medical record system. There will be transparency. Other people will see what you are doing. Of course, with the help of the permission of the patient. There could be an OTP which can be given and it can be done. So I think it is a must. Then there has to be an effective legal system protect both the interest of the patient as well as the interest of the hospital and the doctors. It is a must. Now, for the time being, the consumer protection has been taken away, but then we don't know. At the time, it can come back. There has to be an effective legal system to maintain the fairness of the system. So I think these are the most important government things, because if you go discuss nitty-gritty, there will be a lot of things, but then we don't have much time for that. Now, at hospital levels, what can be done? I said I am saying things openly. I think the most important thing which the hospitals should not do is target fixing. Unfortunately, many 5-star systems, corporate systems are given, doctors are given targets. Whether people will accept it or not, I am very sure about that. This has to go. Because if you fix a target for a doctor, then things are going to be difficult. I said, I don't mince my words. This is a fact. I know for sure it is there. Probably an MBA fellow will come and tell you subtly or explicitly. That's all the difference. Okay. So that's it. That is one reason why I thought I should not be being part of a hospital system, because probably I will not be able to tolerate it. Anyway, promoting competition among doctors, another strategy which is employed by new corporate hospitals. Instead of 3 ENT surgeons, there are 6 ENT surgeons. Instead of 3 pediatricians, there are 25 pediatricians. So naturally, there will be competition. Who generates maximum money will get more patients. I mean, that is a system which is being followed, whether you accept it or not. I think that has to go. Incentive-based system. Probably most of the time throughout, I worked on a salary. They offered me an incentive system, which I refused. Incentive-based system will naturally promote more surgeries, more investigations, more unwanted medical things. Again, that is a fact. But then the salary has to be very good. You don't have to do certain things. Cutthroat commercializations. It is again a fact. Now, you know, you look around. Major cities in India, major cities in Kerala, the type of advertisements they do, unhealthy advertisements. Probably the doctor may not be able to do advertisements, but then a 5-star hospital as major hospital doing unhealthy advertisements, a person sitting at home like me, what I will do. There is no visibility. Probably I will start unfairer methods. I will be forced to do unfairer methods. So probably there has to be a control on many things. The availability of medical records, again, still a problem. Actually, every patient has the right for all the medical records. By legally, that is the system. But still, for most of the people, it is difficult. They say it is in our system, there is their digital, practically impossible to get. All these things they say, and 90% of the people, they do everything once again. Option in pharmacy. Now, no prescriptions are given for most of the people. If I have a chance to get the medicines at 20% less cost, 10% less cost, I should be given that choice. My hospital management 23 years back asked me to do this thing, send the prescriptions to the pharmacy. I said, nothing doing. If you have a good system, if you can delay, the problem was actually, it's not the cost. It was actually the delay in my hospital. It was around 2 hours for seeing me, 3 hours for getting the medicine. Who will tolerate this? So I started giving out the prescription. They said, it is preferable to go to the pharmacy. I said, nothing doing. Finally, I won. Now, anyway, then insurance malpractice. What is this? For many hospitals, if you are a non-insurance fellow, the cost is one thing. And insurance, if you are having insurance, your cost is different. This is again a fact. I had a policy, I will not cheat my patient, I will not cheat my hospital, I will not cheat the insurance company. This was, I had a lot of issues. Somebody will ask me to admit for the sake of getting a CT scan done, I will not say yes. MRI, I will not say yes. Because that is a system. I don't cheat anybody. That is a system. I don't cheat the patient. I don't cheat the hospital also. I don't cheat even the insurance company. Then he will face a lot of issues. That is why at the age of 48, I was at home. A surgeon. Anyway. So probably I think these are the ideal methods by which a hospital can ensure a fairer system. I don't know how far it is practical, but that is a system. At society level, what can be done? I think the most important thing is patient education. If the patient is aware of all his options, probably he will have a better, fairer system. Creating awareness of his rights as a patient. Society has to do. Somebody has to do it. The press has to do it. The media has to do it. I mean, whoever is capable of doing that has to do it. There has to be watchdogs, whether there is Consumer Protection Forum or anybody, because unless somebody is there to look after, look at things, probably there is a tendency for you to go do unfair practices. Fighting for patient rights has to be there by some system in the society. Necessary lobbying in the government. Sometimes society, when the new law is coming, when suppose there is a law coming which is saying corporate hospitals are above everything, somebody has to look into it from the aspect of patient. So the necessary lobbying has to be done with the MLA or MB or the government from their side as well as from our side. Now, what about organization? Again, patient education is a very important part of that. This could be a non-profit organization, an organization like Wipro or Infosys. Creating awareness of the rights of the patient, charity support, because most of these big hospitals and big organizations load a lot of charity support, right? CSR schemes, you know that 2% of their profit, they are making about 1,000 crores in a year, has to go through the CSR. They can support governments, even big corporates, big companies, even they're capable of supporting governments for schemes. Then there has to be good insurance companies with the government, outside private, there has to be competition. We'll take the better system. We can't tolerate the US system. See, for any US president, the biggest challenge is two things. One is medical insurance. Second thing is immigration. They are still not able to tackle that. They may tackle Afghanistan, they may tackle UK, they may tackle China, but they are not able to tackle the insurance system in their own country, health insurance system. So it's not a simple thing. Then what about patient level? In patient level, you need the facility to seek help. The most important thing for a patient is the ability to seek help rather than just go to a hospital. I think that will help him a lot. Health education, naturally, I am not going to explain that. Preventive measures by the patient so that his health expenses are at low. Whether it is immunization, whether it is the diet or exercise, all the preventive measures he has to do. I'm not going into the details. Everybody in today's world, even a doctor, has to have a medical insurance. But you know, that is what was very clear. Suppose a doctor is actually in a private hospital having COVID treatment for 1 week, the bill would have come to around, if it is not on a ventilator. There are interesting cases where a doctor had to pay after this, the family has to pay up to 30 lakhs to the hospital. Okay. So you should have sufficient medical insurance. Exercise extreme caution from the patient level, because many accidents can happen in a hospital. There are human errors possible. Definitely you have to be on the vigil. Very interesting case. We had 2 COVID vaccination was successfully given to one particular female. Where was she looking? I don't know. How can somebody give an IM injection without my approval? Somebody has given you an injection. I should have been smart enough to say that, see, it has already been given. This stupid patient, stupid, not patient, probably stupid individual allowed the second dose. I don't know. They can say so many things. See, the problem is in the mass vaccination, whoever is on that stool is supposed to be a person who has to be given an injection. I was there in a system. It is every likely possibility that I will be given a second shot if I keep sitting there by another sister. There is not one particular sister which is giving the injection. She goes and fills from inside. Then the another person is coming out. That person will give, if you keep on sitting in that stool, stupidity. That is pure stupidity. And if you allow that, it is still more stupidity. So you need to have exercise similar extreme caution throughout your medical treatment. That is what I have seen. A lot of human errors made by doctors, made by sisters, made by attendants, made by so many people. We can have any sort of foolproof system, still we make mistakes. So the patient and his relatives has to cause extreme exercise, extreme caution if he has to get a fairer treatment in his own interest. Open communication. If you have a doubt, don't assume. You have to talk to the doctor, you have to talk to the nurse. That is the responsibility of the patient. See, I am a communicator. I'm supposed to be a communication expert. I explain very clearly because I don't see so many patients. I do very clear-cut explanation to the patient. Each what has to be done, everything. But still, people make mistakes because they assume they thought like that. So avoid misunderstanding. See, I'll tell you. Yesterday morning, I put up a post in Facebook because I have a lot of followers. At least around 25,000 people see my post. So I just wrote this THRISSUR IMA has asked me for a talk like this. I would like to include patients or the common man's views in this. There are there are very, very few constructive. I think I won't say even one or two were there. So people are not aware of this. They in in ICU, you treat patients without, I mean, you put them in ICU without anything. You give unnecessary investigation. You give unnecessary medicines. A lot of medicines which is being given taken from the pharmacy to a particular patient is given back to the pharmacy and it is being charged. These are the things which they think is being happening. If your patient is dying, then you keep on ventilating. Now, I don't know how far it is possible. Medically, it is impossible. I think it is impossible to ventilate a patient who has actually died, really died. There are a lot of checks and balances even in the ventilator system because there is a lot of recordings. I don't know how it is possible, but that people, our general educated people think that is what is happening in our own private hospitals. So I think there is no point in getting a fairer system unless the people think it is still unfair. So it is our duty to have a good communication with the patient or patient's relative because they assume. If it is from the patient's level, if they assume, they will see, we have our own system of defending. They will have to undergo through the court. If they think it was an unfair thing which was done to them, naturally, they will go to court. If it is an unfair system, probably they will lose. After 2 years, 3 years, they will have to spend a lot of money after the issue. They will have to spend a lot of money with the advocate and the court, thinking that injustice was done to them. Probably they are assuming. I don't know. So at the patient level, and I think the best thing I would advise for a patient is to have a doctor friend. If you have a doctor friend, I think I always say to my people, you should have 3 people as your friends. One an advocate, another one an accountant, another one a doctor. If you have three persons, if you are lucky enough to have good 3 of them as your friends, you are saving a lot of things in your life. Anyway, no, I think something which is very, very important and at doctor level, what we can do. I think it is sufficient to say we need to have practice ethical medicine, ethical practice on every aspect. Every aspect. We are aware of that. I am not going into the details of that. There is nothing now to teach you on ethical practice Because all of us we should be aware of that, and we should stick on to it. And another important thing I think is we need to avoid greed. I think unfortunately it is there. Most of us never stop to think about what is it that we truly want. Unfortunately, we are actually in a trap. Most of us blindly chase money or career success. That is a fact, without ever taking the time to question what should be or what would be truly make us happy and fulfilled. This is actually from a talk which I gave to my END colleagues in Cochin on rethinking on life. But a few things. Most of us are in a lot of traps. It's not only money. Money is the first trap. There is no doubt about it. Money is a big trap for most of us. Then there are wants. What are these wants? You want luxuries in life. There is nothing wrong in, say, money. Is it money? It's important. Many people say money is not relevant. Money is very important. Money is very relevant. Many people will say money is not relevant, but for all relevant things in your life, you need money. If they know that you are a doctor, they will charge you probably a slight premium, because that is their concept about a doctor. So you need money. Now about your wants, whether you want to have a ordinary Honda City or Mercedes Benz or Audi Q7, it is your choice. But then for wants, if you have bigger wants, probably you will have to charge more. I don't know. Power. You need power as the department head or the head of the institution. You want to run your own hospital. I don't know. Power is a trap, I think. Fame is another big trap for a doctor. Recognition could be a trap. Profession itself could be a trap. I'll tell you, if you know only to practice medicine, most of you are like that. You are actually in a big trap. You will have to face the music of your hospital owner or the government. But a person like me, the income I earn from medical practice is very limited. So I can afford to do that. I can afford to take my own decisions regarding medical practice. So profession could be a trap. Your family could be a trap. When I shifted out from a corporate hospital system, my family was really shocked. 7 years back, when I decided that I'm not going to any hospitals, private hospital, they were in a total shock. My mother was in a shock. Most of my family were in a shock. But I don't regret that. Okay. So family could be a trap. Your EMI could be a trap. I know doctors who are having an EMI of up to 1.5 lakhs per month for their car and the hospital, their car and the house together. One of the biggest traps are EMIs. So you decide what are your traps, because if you are in a trap, you will not be able to take fairer decisions regarding your patient. Ultimately, you will have to decide, when is it ever good enough? When is it ever good enough? See, I don't think our doctors are going to spend at least 10% of what they have earned before they die. I spend a lot. I travel a lot. I enjoy a lot. I still have surplus money after a fairer practice. Of course, I have other source of income, because it's not from my family or my wife's family. I have told that if you want to have a talk on that, probably I will. It is making money is different. Keeping money is different. Multiplying money is different. These are all different totally. Probably doctors know how to make money. Though doctors are the worst professionals who don't know how to keep money. People take away their money. Okay. So making money, keeping money, and multiplying money is entirely different ball game. Okay. Right. Now, every one of you should define your success, whether it is only money or something else. For me, personally, success is doing what I want to do, when I want to do, with whom I want to do. This is something which is very, very important. You should have your own success statement. If you think you have more than enough money for your lifetime, for your family, probably you can then now concentrate on a fairer medical practice. I think that is possible. Now, anyway, I think there is something called a wheel of life. As a doctor, you must have heard about visual analog scale. where you judge your pain, the patient's pain, on a scale of 0 to 10. Like that, you should actually assess your finance, personal growth, health, family, relationship, social life, attitude, and career. I will end in few minutes. There is something called visual analog scale. This is called a wheel of life, where you plot where do you stand exactly with finance, where do you stand with personal growth, health, family, all these things, and you plot and do something like this. If it is not a rounded thing, you may end up in a divorce, even if you are having a good money, or your children may leave you. That wheel of life has to be balanced. So it is very important that you have a balanced life before you go after money. It could be spirituality, travel, or anything you want. Very interesting concept. So what all things you should put that in the wheel of life is different. It is totally left to you. Whether it could be a relationship or spirituality, profession, money. The 8 most important things in your life, you have to assess constantly. And every time you need to ask what makes you truly happy. I also would like you to ask yourself, why did you take up this profession originally at the age of 70? Because I decided to take up medicine at the age of 12, seeing my mother, who was a nurse, who was in charge of the theater of Medical College Trivandrum. She was in charge of 36 tables. When I first go to her, the hospital, I was fascinated. I wanted to become a surgeon. And at the age of 48, finally, I stopped doing surgeries. Or probably I cut down on surgeries. And by the age of 50, I stopped doing surgeries. That was my passion, to become a surgeon. Why did you take up this profession originally? Whether it was to serve patients or to make money, all these things probably you have to really think again at all stages. Have you ever thought about the real purpose of your life? A very important concept. I think it is very, very relevant for any doctor, even if you are not a doctor. So my concept was, you have to think. Think on what we discussed. You have to contemplate on that. You have to process what we discussed with your own intelligence. And if you think you need to make some changes in your practice, you need to make something in your life change, because basically that is how I impart change in my clients as a change specialist. I discuss with them, I talk to them, I ask questions. So in summary, I was saying all great changes are preceded by chaos. This is a right chaos. I have gained a lot during this COVID phase. One of the best time for my education, whether it is life coaching or business coaching or medical knowledge. I have attended around 250 webinars. Most of them are, some of them are paid, some of them are free, by excellent people from around the world. And I have decided to handle my money after that from January onwards, Probably I'm better qualified than many of the professionals in managing my money. So you need to make money. No, there is no other way. If you do not change direction, you might end up where you are heading. This is a very famous statement by Lao Tzu, a famous philosopher. If you think you need to take a change in direction, you should do. These changes we dread most may contain our salvation. Said by Barbara Kingsolver, a famous author. If you change, ultimately, it may end up in our salvation. Now, who can change who? Very interesting. Yesterday, I was clever, so I wanted to change the world. Today, I'm wise, so I'm changing myself. Said by Rumi, the great philosopher. And you should probably combine success with balance and harmony. And I would like you to ask this question. Are you climbing the right mountain in your life? Each of us can climb one mountain, or very few can climb the second mountain in our life. But at the age of 60s, 70s, if you think you are climbing the wrong mountain, it's like a big waste of your life. Is your journey worth the real struggle you're doing? That is another question which you have to ask. Will the end justify the means? See, probably self-worth, purpose, love, peace, freedom, fame, success, balance, money, growth, fulfillment, achievement. This is actually a mountain. You have to do a lot of sacrifices as a doctor, suffering as a doctor, stress as a doctor. You must be aware of the data of the Social Security scheme. Most of the doctors died. Many of our doctors died between the ages of 50 and 60 or 65 because of stress-related diseases. So you should ask if there is an entirely different mountain you are meant to climb. I have discovered that mountain. I practice that along with practicing my kind of medicine. So the request is to, at this juncture, to rethink on your life. The cost of not doing it might be a life you could have lived. So with this, I end my talk, finally saying the WHO message. We should agree that health is a right, not a privilege. It's time to build a fairer, healthier world for everyone, everywhere. So I wish you a happy World Health Day by eating healthily, exercising regularly, living happily, and dying gracefully. A very important concept for me, dying gracefully. Thank you so much. I end my talk. I am open for discussion if you are interested. So that's it. I think I have anybody here?
Yeah, we are all here.
Because that is another problem with the Zoom. You can
We are
turn
all
on the
immersed
video
in your
and
talk.
go away. Anyway,
We are all immersed in your talk.
yeah, okay. If anybody wants to switch on the video and have a discussion on this practicality of the things,
Definitely.
probably I will be able to guide you as a person who is gone through all these areas: corporate hospital, home practice, the difficulties, the problems you face from the family, outside family, your own colleagues. People say I was mad. My END surgeon said, you are really mad to stop your practice from hospital, because I was having a very good practice. Anyway, I actually, I'll tell you, I don't regret. I should have left much earlier. That is what I feel. In fact, my wife is a doctor. She's a gynecologist with government hospital, government system in district hospital Cochin, gynecologist. To both doctors, I said, if you want money, I will tell you better things. Rather than going for medical profession, I will give you many better ways how you can make much better money, much less stress in your life. But both of them selected medicine, unfortunately. Fortunately, I don't know. One is studying in Aravind High Hospital, ophthalmology PG. The other one is having her final examination right now, medicine. I mean, MBBS final examination. It is going to be a tougher world for them, unlike me, because now there is tougher competition. I personally, in the current world, I would have never taken medicine, because I cannot tolerate the current system. I want freedom. I want my own ways. It's practically impossible. Whether even if you are in the government system, it is practically impossible. Let's discuss if you want, or we can stop.
Anybody wants to ask questions? You can put.
Questions or comments or the impracticalities of these things. I will definitely say this is not practical. The income I generate per month is far low at my house. But then I have different source of income. So that is actually something which you should know. None of these things are easy. It is extremely difficult. I charge high, like I charge 500 rupees per consultation. But then, because I don't have any other income, right? So probably less people will come to me also. That is also there, because that is the practical difficulty of the things. But I think I can afford to charge because I am 25 years into my practice.
There is a question in the chat box.
Yeah.
Sir, do you regret being a doctor?
Yes. I could have done. See, I taken that decision at the age of 15 or 12. I could have done much better. If I was, the biggest problem was I enjoyed a good life throughout. So that, see, if you look at certain things, like initially, you have to fail initially. You have to fail early if you want to create really a change in this world. I was actually a successful person throughout my life. I got into medicine the first time. I was one of the best outgoing students from medicine. I got into ENT. I actually wanted to be a plastic surgeon. I even took ENT because I can be a plastic surgeon even with ENT. And I could have done much better in different areas because I had a lot of other skills. It's not that I don't enjoy. See, people tell about passion. You should be passionate. What is my passion in treating a tonsillitis? What is my passion? I thought, because I asked this question to my business clients. People say you should follow your passion. Probably medicine was a passion before I got into it. Once I start practicing ENT, probably once in a while, 3 of my surgeries have come in the front pages of paper. Certain rare things which I have done, along with some other surgeon. We had a concept called Team Cafe because we also was the first head and neck surgery unit, even before Amrita. I had a maxillofacial surgeon working along with me in PVS hospital. We set up that. It's called brand named as Team Cafe. We did good practice. We did certain surgeries which came out in the front pages of paper, certain rare things. But then even our surgical strategies were there in the American journal. But then what is the passion in doing another tonsillectomy or another septoplasty for me? It's just a routine thing which I have to do for my practice, for earning my bread and butter. So passion is no more there. Probably I'm giving a talk like this gives me a much more kick, wow effect after this end of the day. Frankly, I'm speaking. You need to have a daily wow effect if you want to have a happy life. One of my very interesting topic is on happiness unlimited. You need to have a wow effect daily, a small dose of wow. Money, see, I have traveled throughout the world, even with my limited money I earned. I lost a lot of money. Smart people took away my money in investments or as kadam. But now I have learned, next week, my children are coming. 7 days. The only agenda is teach them on money. It's not money from the medical practice, on how they can grow their money. I am now good at it, so I do that. That is my agenda, or that next for them, because they should know at least how to keep my money, which I am going to pass on. No, ultimately that is important. Doctors were there in Manjiam. Most of the doctors were there in Manjiam because they had a lot of black money. Now doctors are not having much black money, so they are now very careful. Anyway, so I do regret. It's not that I regret my practice. I love my practice because I can practice the way I want right now. I still good at it, very good at it. But then I won't take up it again.
So compared to the stress and issues you have mentioned in the corporate sector, don't you think the government sector is much better from what you have said?
No.
Do you think so?
No, because
Why
my
not?
wife, being a gynecologist in General Hospital, I think she's under tremendous stress. I know what problems she has undergone. There was one lady who gave a complaint saying that our SC/ST ആയതുകൊണ്ടാണ് അവരെ ട്രീറ്റ് ചെയ്തത്. നിങ്ങൾക്ക് എങ്ങനെ അറിയാൻ പറ്റും നിങ്ങളുടെ ഫ്രണ്ടിൽ വരുന്ന പേഷ്യന്റ് SC/ST ആണെന്ന്? I mean, these are the kind of allegations people do. ഞാൻ പറഞ്ഞില്ലേ, അതുകൊണ്ട് it goes for years. So I think our system, if you succumb to the pressure from the management, it is difficult. Now, see, നമ്മുടെ അതിനകത്ത് military like hierarchy ആണ്. You will have to follow what your department, because of the vicarious liability, you will have to follow what your department head is saying. If you have a stupid department head and you are working under him, I don't know, that stress is going to be tremendous. Isn't it? I think in doctor's life is under so much stress, whether it is government or private. Then there are lucky persons like me who do my kind of practice. Probably my stress is much less. My stress is, I would say, my medical, because I can say no to anyone, no? Because of my kind of practice. I don't yield to any patient regarding what they do. I am very strict on my things. Even I have very clearly stated that in my site, If you don't want to follow my system, please go to some other person. No. I take care of my patients. That is a different aspect. What I'm saying is I do my kind of practice.
Is it because of you had other source of income?
So that source of income has acquired. Anybody can acquire a different source of income. Even any doctor can do that. If you are not doing it, you are in a big trouble because you will have to listen to stupids. Whether it is patient or the management or the government. Things which you don't agree to, you are forced to do. I have acquired that skill from the age of 30 over the years. Probably doctors should know how to multiply their money. At least they should know. Because by the age of 40, your tolerance will come down. By the age of 45, 46 and 50, I don't know. How many of you can tolerate a stupid patient? Frankly speaking, tell me, very frankly speaking. Because you don't have a choice. Somebody is giving 500 rupees to the corporate hospital, you will have to see him. How can you say no to a government patient in a government hospital? No, you will have to follow the system. You have a source of different source of income. So your freedom is totally different. Totally different. That is one big advice I can give you. It is difficult. It is not that easy. It is difficult, but it can be done. In fact, I would recommend every doctor to have a different source of income. I think it is possible legally. I am reasonably good at investing. That is because that is one thing which I do because I don't have to bend my neck or back to anyone. It is not easy. It is very likely chance that you will lose money also there if you are not good enough, because the market is one unpardonable situation. It will not pardon for your stupidness. So that is where I am getting better and better.
You should be a good businessman.
No, I am not a good businessman. I am not a good businessman.
You want to invest in shares and all.
But I am, no, investing shares is totally different with business. I am good in business. I am good in advising business because I have learned that. Now, very interesting, how I came into life coaching and business coaching. Many people ask me, as if you are an ENT surgeon, you will know in ENT areas, a lot of things are there psychosomatic, like headache, backache, earache, which is actually due to stress. So if you ask your patient to avoid stress, you are not helping him in any way. How will I remove my stress? If somebody is asking you, what is the answer you are giving? Dr. Dinesh has gone. See, psychiatrists can help a person with a disease, isn't it? They can actually fill up the dent. But a normal person having a lot of stress in his business, in life, who is going to help him? I don't know. Do we have sufficient system? So that is how I actually learned this life coaching for so many years. Then finally, I understood even a life coach will not be able to help a businessman if he's having trouble with his business. So I slowly moved into business coaching, better ways of handling business, doing their business. Then finally, I went and studied one of the best institutes. The SP Jain is actually a wonderful institute, which their faculties have taught me. There was actually a system that is called Honor Global Management Program, very expensive program, but then I had a chance, so I attended that. In fact, their webinars during this COVID gave me the best education I would have ever received in my life. In this COVID phase, that's why I said, and finally, that is when I decided I will handle my own money. Actually, professionals were managing my own money. They actually played a havoc during COVID times. My asset value reduced to 40% during COVID time. Because even when the professionals were handling, they had no idea what is going to happen. So finally, I took over from January 1st onwards. So that's it. You need money. There is no shortcut for money.
Yeah, you need money. At the end of the day, you need money.
Yeah. See, That is where I'll tell you something if you're interested in that. How many of you can say you will have the same lifestyle for the rest of your life when you are stopping working today? How many of you can say you will have the same lifestyle, quality of lifestyle, if you stop working today for the rest of your life? If you are at 30 or 40, then there are life up to 90. I had that courage. That is why my hospital, when they appointed an assistant without asking me, on that spur, I quit my job after 18 years in a single hospital. 7 years back. Now the hospital is no more there because of their bad management practice. You know, the previous is no more there. I left 7 years back because they did something which I think is unacceptable for me. On that day, I have decided I will not join any other hospital because I know what was in store for me. When I joined previous hospital 25 years of back, the type of medicine which the people are practicing and the current system is totally different. I don't want to, I live like a king there. It's not that I patient hospital insurance company, I live like a king. That is, I was the only doctor who was allowed to put the final bill and work backwards in PVS. I am so proud about that. When I said this particular surgery will cost 50,000 rupees, everything is worked backwards. Final bill will be at 50,000 rupees. I used to, because so my patients were so happy about that. And of course, if there is an untoward incident, that is a different issue. That is a different issue. Okay. But I had that privilege because they had full faith in me, at least during the early phase. So that it's not an easy thing. It's a very, very difficult situation for all the doctors. I agree. I am sure you are aware of the targets which are there for 5-star hospitals. At least in Cochin, I can say that. I don't know and about other places.
It's everywhere in the world.
They will come and show you a graph every week or at least once in a month where you stand. What does that imply? You need to write your OP is less, investigation is probably like this, your surgeries are like, what does that imply? They will show you the way, door after some time. And if you run your own hospital, your stress is phenomenal. Everybody is after you, isn't it? So it's not a good world. That's actually, in fact, that is the reason why I advise my daughters. It's very easy to say you treat everybody. Interestingly, in Aravind High Hospital, when she joined, the first sentence which was said by the director is, we have free patients, we are partially paying patients, we have actually fully paying patients. But the quality of treatment should not differ to anyone. That is why Harvard has taken up their business model, charity business model of Aravind High Hospital. Fantastic place to learn. And they said, when you go out of this hospital, you should know how to run a hospital like this. That is their aim in teaching students. It's not right just to practice ophthalmology. Phenomenal place. Anyway, any other questions or apprehensions regarding fairness of medical practice?
Dr. M.N. Menon, you want to ask anything? He usually puts a lot of questions.
Namade Menon sir?
Yes.
Probably.
Very good evening.
Good. You are there throughout?
Yeah. He always comes to
He is part of the ethical system, ethical committee. Probably is much more aware of the problem, isn't it?
A great life coach and a great speaker and whatnot. So
no, I'm saying it is extremely difficult to practice fair medicine in this country. Extremely difficult. People will not pay for professionalism. They will not pay for advice.
Correct.
But they will happily pay for a CT scan. They will happily pay for surgery. If you say you don't have a surgery, you're finished. You get 500 rupees, isn't it? Maximum you get.
So today's theme was building a fairer and healthier world.
With a perspective from a doctor's side.
Let me tell you, the message was clear. But you have been very much impressive in your presentation that you have opened the closed windows in the hearts of most of the professionals here. Because that is an angle which we always know, but we keep it shut. We are not bothered about how happy we are living, what is our future, how are we managing our finance, a lot of things. These things have to be thought about by all of us. That is one thing. And talking about the digital record, I think Clinical Establishment Act has advised us to go for this soon, as soon as possible. It is there.
It has to be run by the government.
Similarly, right of medical records for the patient. There is a law, that ethical regulation, that within 72 hours you are supposed to give. If the patient knows it, he can go to the court or police and get it within 72 hours. That is their right. And as the ethics committee member of National Standing Committee on Ethics, we are now actually into getting some suggestions and views and modifying the Code of Ethics as the NMC is coming up with the guidelines soon. So we are actually creating an IMA Code of Medical Ethics, because the other thing is different. So we are giving our suggestions. What we are going to create one, especially regarding the corporate hospital practice and other things, and how we ourselves ignore the ethical guidelines. Most of the ethical violations happen because you are not aware of the ethical guidelines, because it was not taught previously. But now in the curriculum, it is a subject. It is a continuous subject for the continuous curriculum period. That is happening now only. So I think out of 6 lakh doctors in India, at least 5 lakh doctors are not bothered about ethics or ethical regulations. We practice ethically because our teachers were role models. That is how we picked up ethics. And our family traditions, all these things come into play. But the present generation is not that much concerned about ethics.
Sir, another reason.
Yeah.
For example, I paid 600 rupees as a tuition fee for the medical 1 year. 1 year. My daughter is paying 10.5 lakh rupees for a merit seat.
Yeah, same thing.
10 point. So normally their perspective could change, no?
Correct.
Their perspective could change.
That is one thing. Second thing is that we did a survey when I was in the ethics committee a few years back in Kerala. So even I am continuing now also. We did a survey among young doctors and house agents. We asked a few questions like, do you know about ethics? No, we have no idea. 45 to 55% have no idea what is ethics. We asked them, will you receive some commissions and cuts from pharma companies if they offer? Why not? 75% of the people said. And the 25% people said, we will receive it, but we will give it back to the patients. So these are the situation that is happening. That is why actually, in fact, we had recommended the national body to request the Medical Council of India to include ethics as a subject about 8 years back. Now it is becoming a truth. That is one aspect of it. Anyway, I think Joy Manjula and dear Pawan, you can have another session on doctors' well-being and financial security.
Actually, a very interesting topic I discussed with ENT surgeons in Cochin. Rethink on life. It's a very interesting topic because I just said 1 or 2 aspects about that in this thing. But I think that is a very interesting topic.
We need such sessions actually.
And actually, doctors, now, previously, I'm not mentioning the names. They were actually jealous of me. Most of the top departments are. I dream about a life like Vinod. It's actually a mindset. It's not like that. It's actually a mindset. You should enjoy your life. What prevents you from enjoying life? I traveled all the country, most of the you are making enough money to do all these things. But only thing is you are not spending it. IMA ഒരു വർഷം ഇങ്ങനെയായിരുന്നു. കാശ് കൊടുക്കുന്ന സമയത്ത് കള്ള് കുടിച്ച് കാശ് കൊടുത്ത് കള്ള് കുടിക്കുന്ന സമയത്ത് 2 ബോട്ടിൽ ചിലവാകുമായിരുന്നു. കാശ് കൊടുക്കാതെ കള്ള് കുടിക്കുന്ന സമയത്ത് സമയത്ത് 15 ബോട്ടിൽ ചിലവാകുമായിരുന്നു. We don't spend money. We are used to getting a lot of freebies. We don't know how to spend money. It is a wonderful thing to spend your money enjoying life. അത് അനുഭവിക്കും മാത്രമേ അതിന്റെ സുഖം മനസ്സിലാവും. ഇതെല്ലാം കൂടെ ശേഖരിച്ച് വെച്ച് വീട്ടുകാർക്ക് കൊടുത്തിട്ട് എന്ത് ചെയ്യാൻ പോണ്?
True. Anyway, that's it. Anyway, I enjoyed it. Once again, thank you very much. And let somebody else talk.
Yes.
So we had
interesting talk, sir. അടുത്തൊരു മീറ്റിംഗ് ഉണ്ടെങ്കിൽ സാർ ടോക്ക് ഉണ്ടെങ്കിൽ കേട്ടാ കൊള്ളാന്നുണ്ട്.
അത് നമുക്ക് ഉടനെ വേണമെന്നില്ലെങ്കിൽ എപ്പോഴെങ്കിലും.
അല്ല, ഇത് ഐഡിയ ഈ സാർ പറഞ്ഞ മാതിരി നമുക്ക് എപ്പോഴാണ് നിർത്തേണ്ടതെന്ന് നമുക്കറിയില്ല. നമ്മൾ സ്പെൻഡ് ചെയ്യാൻ വേണ്ടിയിട്ട് മടിക്കുന്ന ഒരു സമൂഹമാണ് നമ്മുടെ ഡോക്ടർ. സാർ പറഞ്ഞ
so there is a system by which you can do that. Probably someday I will talk to you. There is a system by which you can do that. You can say how much is good enough. അത് നമുക്ക് you have total uncertainty.